understandably, we want to know what's going to happen to our health insurance next year. Adam, welcome.
Hey, good afternoon, Laura. Thanks for having me. It's great to see you again.
So tell us, for people that maybe were not paying attention before, or just a quick refresher, what happened the last time around when President Trump took office? What happened to health insurance?
Yeah, so even before he took office, I'll sort of remind folks that one of the main platforms that then candidate Trump ran on was outright repeal of the Affordable Care Act. It was a very popular position among Republicans at the time. He made it a main focus of his candidacy and vowed repeatedly to repeal it, sometimes on day one. So, once he was elected president and had Republican majorities in the House and Senate who were like-minded, that was one of their first priorities. And they tried a few different ways to repeal the Affordable Care Act. Ultimately failed because of 3 Republican no votes, and Senator Collins, Murkowski, and a surprise no vote from John McCain. But still, after that, the administration under Trump undertook a lot of actions to still sort of quietly undermine and otherwise kind of chip away at the Affordable Care Act, including, not to get too far into the weeds, but short-term junk plans that were only meant as kind of a stopgap in between insurance policies because they don't really provide a whole lot of protections. Those were allowed to expand. They cut a lot of funding to things like navigators on the insurance exchange and money for advertising for open enrollment. So, through those sort of actions, instead of outright repeal, they managed to do a lot of work to kind of change and minimize the Affordable Care Act to the degree that they could. But as I said, the Affordable Care Act was still a law of the land. So by the time the Biden administration took over, they were able to restore a lot of what was already in place and then expand it through things like premiums for insurance gain on the exchange.
And so this time around, given that Donald Trump didn't talk so much about repealing the Affordable Care Act, but J.D. Vance did talk about major changes and going back to risk pools and so on. So what are the things you think could happen next year? Maybe what's likely and what's maybe less likely?
Yeah, I'll start with first a caveat that none of us know for sure, right? There's still a couple more months before the administration takes over and before the new Congress is sworn in. But here again, we have a situation with President Trump, who has at least been hostile to the Affordable Care Act, and Republicans taking majorities in the House and Senate. But as you mentioned, a couple of indicators that we've seen on the campaign trail and otherwise, his running mate, J.D. Vance, mentioned a system in which you separated high-risk people out of the insurance pool and put them in a separate pool. A lot of experts have pointed out that this has a lot of problems because once you do that, it kind of spirals into an unaffordable marketplace of insurance. And so while it's a very affordable one for those who are not high risk, kind of the point of insurance is for those who are low risk to kind of help subsidize those who are more high risk. So it's not a thing that seems very feasible in practice. But one thing that has been kind of a hallmark of this candidate and this president is that he is unpredictable. I think he would kind of revel in that characterization of him. We're not sure exactly what he's going to prioritize. And that's kind of evident in his pick for Secretary of Health and Human Services in Robert F. Kennedy Jr. This is a person who doesn't have any government experience. So it's unclear what his priorities are going to be, what President Trump's priorities are going to be. But I think, as I said, other indications that we've seen, one, he's not a big fan of regulation. Again, going back to the junk plan regulation that he undid in the first term. And he's not a big fan of some of the big costs safety net programs, including and especially Medicaid. So I would imagine to kind of maybe fund some of the priorities that Republicans are looking at, including restoring some of the tax cuts that were implemented under the first term. I think that's one that has a big target on its back is cuts to Medicaid in particular.
Let's talk about Medicaid because people may be unfamiliar of who can get Medicaid and who might be at risk. So most states expanded Medicaid so that anybody that made under a certain amount of money would be eligible for health insurance. But Medicaid also covers people with disabilities, seniors that need extra care. Want to talk a little bit about what's at risk if they start talking about cutting Medicaid?
Yeah, of course, and it's under the last 15 years that the Affordable Care Act expanded Medicaid, as you mentioned, not just but especially in states that have elected to expand it up to 133% of the federal poverty level. So now 72 million Americans rely on Medicaid, and there's a lot of ways that you could cut it. One is to try and roll back some of those expansions. Another is through implementing work requirements, sort of proof that you're working or trying to get a job in order to stay on benefits. And that, as it's been implemented in some other states, has really just kind of had more of a chilling effect. It doesn't have the desired effect of, ensuring that people who are on Medicaid are actually working. It more has the result of having people drop off who just failed to fill out the proper paperwork. And even through SNAP benefits or increased eligibility, more restrictive eligibility requirements for Medicaid, just the cumbersome process of making people renew year after year after year to prove that they're eligible for Medicaid is one way to get people to drop off the roll. So there's a lot of different ways that, at the bottom line cuts costs, but ultimately just gets people to drop off Medicaid who probably ought to still be eligible.
And can you talk a little bit more about what block grants are? Because this is probably something we'll hear a lot about next year. This may be a proposal that maybe sounds good, but talk about what block granting, why this is maybe not as good as it sounds.
This is actually probably where I should say, look, I'm not a policy person or a communications person, and I don't want to get too far into the weeds on block grants or other Medicaid. I'm more in the advocacy space and trying to fight back against some of these calls, because for me, the Medicaid program is working and ought to be expanded further beyond what it is. And even if that's not a very likely outcome over the next 2 to 4 years, I think we can put pressure on some of those members who might vote for either block grants or rolling back benefits, so that they stay in place to the degree they can. And for me, one thing I would say, if you're like me and you don't want some of those programs rolled back, Affordable Care Act or Medicaid, in addition to, I think Senator Collins and Senator Murkowski are going to get a lot of attention as being moderate Republicans who might break with their party on votes like that. I know Senator Tillis in North Carolina is another target because he's up for re-election in 2026 in a purplish state in North Carolina. But I'll go back to 2017 when none of us really thought that John McCain was someone who might break with his party on something like Affordable Care Act repeal. And in 2021, I don't think that Kyrsten Sinema was on many of our lists for those who might break with the Democratic Party. So, all to say that there's a lot of different members, including Joni Ernst in Iowa, Shelley Moore Capito in West Virginia. Even Lindsey Graham in South Carolina has had something of a mavericky streak and was a friend of John McCain's and Joe Biden at one point. I think there's every member is in this new age somewhat unpredictable in terms of like how much will they go along with what Trump wants, how many of them are willing to break with their party, and a lot of them have a lot of constituents who rely on the Affordable Care Act and on Medicaid. So I just think that these next 2 years are going to be marked with a lot of advocacy at a lot of different members of Congress.
Mm-hmm. And we also, it's a little unclear who the Pennsylvania senator's going to be. It's probably going to be the Republican, but they're still counting votes. But they may also be somebody that should be hearing from their constituents to support these programs. And just to go a little bit deeper on the block grants, just like when Trump said that overturning Roe versus Wade would throw this back into the states. One of the issues with block grants is if you give states the amount of money they're getting right now for Medicaid and give it to them as a block grant, that enables them to do good things or bad things with that money. If there's less strings attached, they could decide to cover less people with those funds. And also with block grants, if you are holding that to the same amount next year as this year and so on, that's actually a cut because inflation, of course, increases costs every year. So if you hold the amount that you're giving states for their health care stable, if it doesn't increase every year as costs continue to increase, that's actually a cut. So those are just a few of the reasons why block grants, it might sound good on paper, but it's actually cutting Medicaid and enabling some governors that don't prioritize health insurance for their people to do destructive things with those funds that should be covering. That's what it's for, is to cover the people that need their health insurance. So when are we likely to start hearing things from the administration? I mean, the first order of business is to confirm a Health and Human Services secretary, to run the health department under President Trump, right? And what's the timeline for that?
Yeah, in normal times, shortly after inauguration on January 20th, some of these nominees are put forth. They'll go through committee. In the case of Robert F. Kennedy Jr., he'll have to go through both the Senate Finance Committee and the Senate Help Committee, Health, Education, Labor, and Pensions. And, each of them will have their own hearings, determine if they're acceptable nominees, and then they'll go forward for a full floor vote on the Senate, where they need a simple majority to be confirmed. I say in normal times because we have never seen nominations made this quickly, which is unusual, but also sort of helpful so that we know who we're dealing with, and have a longer vetting process for them, I suppose. But also Trump has already floated the idea of doing so-called recess appointments for a lot of his nominees, meaning that it wouldn't require a full floor vote, and they wouldn't necessarily they could just take over the role as sort of acting secretaries. So all that to say, to be determined, but nothing will happen until the president is sworn in on January 20th. And soon after that, I think we'll see a normal confirmation process through Senate Finance, through Senate Help, and then a full floor vote. Usually all happens within about a month. So by, late February, early March, we could see a full confirmation vote.
Okay, and something else I think people should be thinking about is the head Health and Human Services Secretary is just one person. Another key person is who is in charge of CMS, and that's the Center for Medicare and Medicaid Services. So HHS is up here and CMS is under them, but who actually does a lot of the day-to-day determining of what Medicare or Medicaid looks like is determined by that CMS head. So it isn't just one person, it's all of the people that take these jobs under the Trump administration. Where are they coming from? Are they coming from a insurance company? Are they coming from a pharmaceutical company? What is their background? Will maybe give you some clues as to what they prioritize, whether it's patients or whether it's big drug companies, because again, these folks are going to determine a lot of things like the price negotiations for pharmaceutical drugs under Medicare. So the Health and Human Services Secretary is just the beginning. So Adam, how can people stay on top of everything that's happening with the Affordable Care Act for next year?
I first of all, you're totally right. I think for as much as is made of the Secretary of Health and Human Services, and it's a big role, right? Like it's a huge department. It affects a lot of different people, but even within that, there's just so many sub-departments. CMS is of course the largest one, but there's so much under the Health and Human Services umbrella to keep track of. We at Protect Our Care, we've started our own separate war room just on the nomination and confirmation process of Robert F. Kennedy Jr., and that'll include all the department heads under him. So if you check out protectourcare.org, we will have the latest and greatest information on all things related to that confirmation process. But I do think it's important to stay vigilant, just because there's just 1,000 different ways that this administration could affect health policy for good or bad or something else. And I think it is in darkness where some of these more draconian cuts are able to be made. And the more that we can put a human face on a lot of these, the more effective it is, and the harder it is to undo a lot of these policies that so many people rely on and depend on. So over the next couple of months, we'll see a lot of news on who is either being floated or outright nominated to a lot of these posts. And you're right, it's important to look what their background is, what their track record is. And it's why I point out that, Robert F. Kennedy Jr., for whatever he has said on healthcare, from vaccines to make America healthy and to food preservatives, whether you agree with them or not, the biggest part of HHS is really just being the manager of a huge, sprawling department that touches a lot of people's lives. And a lot of that's going to be at the whim of Donald Trump himself and others in the White House who oversee domestic policy.
Thank you so much for joining us, Adam. And as he made clear, we will just have to see what happens next year. But you should stay involved, follow Protect Our Care on all the social media platforms, and get their email updates. And they will be keeping you up to date with what this looks like next year. Because last time around, it took a real fight to keep the protections of the Affordable Care Act. And we don't know yet if people are going to try to chip away at the law or try to remove it entirely. And that affects all of us. So stay tuned. We are too. And now we're going to get to some of our viewer questions. So open enrollment is going on right now for the Affordable Care Act and for Medicare. But let's talk about the Affordable Care Act. Who can get a policy right now, and how do you sign up for health insurance? To answer that, welcome Louise Norris from healthinsurance.org.
Thank you so much, Laura. It's a pleasure to be here. So when we talk about Affordable Care Act insurance, the Affordable Care Act actually touches most types of health insurance, but people are talking about individual market coverage. So these are plans that you buy if you don't have access to Medicare, Medicaid, or an employer's plan, and you need to buy your own health insurance. So maybe you're self-employed, maybe you work for a small business that doesn't offer health benefits, or maybe you're retired before age 65 and need something until you qualify for Medicare. So the open enrollment period for that started on November 1st, and it goes through January 15th in most states. There are some states where the deadline is different, but December 15th is really the date that people need to keep in mind, because in most states, that's your deadline to sign up for a plan that starts January 1st. So you have basically a little less than a month now to get yourself enrolled in a plan that'll take effect January 1st. All of these plans, so you can start at healthcare.gov. If your state uses healthcare.gov, you'll just go through that platform. If your state runs its own marketplace, like Colorado, California, New York, there are states that don't use healthcare.gov, but you'll be directed to your state's platform from healthcare.gov. So it's a no wrong door portal there. And then you'll be able to put in your income and see whether you qualify for a subsidy. Most people do. This year, 93% of marketplace enrollees qualify for subsidies, and the subsidies cover them for those folks cover the majority of average premiums. So the subsidies can be really significant. It does depend on your income, how much of a subsidy you'll get. And then once you can apply that subsidy to any metal level plan. There's bronze plans, gold plans, silver plans, any of those. So in some areas there are platinum plans. You can apply your subsidy to any of those, and your medical history doesn't matter. The pre-existing conditions are covered. All of the plans are going to cover the ACA's essential health benefits, which means things like maternity care, prescription drugs, mental health coverage, inpatient care, outpatient care. It's all covered. But there's a lot of differences between the plans in terms of out-of-pocket costs and provider networks and what specific drugs they cover. So you do want to allocate a little time to really compare your options. And there's free help available, either from navigators or from brokers, who can help you sort through all the options. You don't have to do it on your own. And you don't pay anything to get assistance with enrolling.
Thank you, Louise. And actually, that's on my list to take care of too, because I need to enroll for next year. So our next question is for Diane Archer from Just Care and Social Security Works. So when are you eligible to sign up for Medicare? And what happens if you don't sign up when you're supposed to? Diane?
Thank you, Louise. Thank you, Louise. Thank you, Laura. So let me just start with open enrollment. Again, you can choose a new Medicare plan now until December 7, and you should definitely take a hard look at your options. If you can enroll in traditional Medicare, you should do so, because that will give you easy access to doctors and hospitals across the country without prior authorization. If you are just now for the first time enrolling in Medicare, you can sign up during the 3 months before your 65th birthday, during the month of your 65th birthday, and during the 3 months after your 65th birthday, without incurring any penalties. If you wait longer than that, there are some significant penalties unless you are covered by your current employer or your spouse's current employer. So that's the only exception. So the best time to sign up is in those 3 months before your 65th birthday, to be sure that you actually will have coverage beginning on the first day of the month of your 65th birthday. And again, you have a choice between traditional Medicare, which you usually will be automatically enrolled in. And the government will take, if you're already taking Social Security benefits, the premium out of your Social Security check. But you have the choice between that government administered traditional Medicare option, which gives you easy access to care, and a private corporate sponsored Medicare, what they call Advantage program, or Part C. And what you need to understand is if you choose a Part C option, a Medicare Advantage option, which you've probably seen advertised on TV, you are taking quite a risk. I mean, it's a similar risk for the ACA because there's so much you can't know about a corporate health plan before you enroll. Some use prior authorization all the time. Some will not delay your care. Some will delay your care. And sometimes you need that care urgently. Some will deny your care inappropriately. And sometimes you need that care desperately. So, and some will actually cut off access to the specialists you need to see or the specialty hospitals you need to see. Most Medicare Advantage plans do not have the best specialists in their networks for you to use. You can sign up if you go the Medicare Advantage option with a Medicare Advantage PPO, which will cover some of your care outside of your network, but it's only partial coverage, and it may not cover care, again, from the doctors you want to see, in part because those doctors may not want to have to deal with your Medicare Advantage plan. Those plans are known in many instances not to pay providers in a timely manner or to deny payment to providers altogether after they provide you with services. So again, it's a little more expensive to sign up upfront with traditional Medicare because you need supplemental coverage to pick up some of the costs that traditional Medicare doesn't cover, the 20% coinsurance. But it will cover your care if you get sick and need costly care without having to go through a lot of hoops, and that can be extraordinarily valuable.
Thank you, Diane. Our next question is from Demetria, who needs a medical procedure done, but her copay is $3,000. She's worked 15 years for senior health senator and doesn't Senior Health Center and doesn't qualify for Medicaid, but through insurance, through her employer, she needs this $3,000 copay. Louise, do you have any suggestions for Demetria or thoughts to consider?
Sure. So, Demetria, I know this is frustrating and hard to find out that you owe, a significant amount of money when you need medical care. For right now, the coverage you have is what it is. So if you're not coming up on an open enrollment period for if I assume you're with an employer sponsored plan, if your employer's open enrollment period isn't happening and you don't have a chance to change your coverage, then you're going to have to work with the doctors to maybe set up a payment plan, to talk to them about the fact that my deductible is $3,000. Can I pay this off over the next year or two? How will this work? If your open enrollment period for your employer's plan is going on now or in the near future, which a lot of them do happen in the fall for coverage to start January 1, you may find that your employer offers multiple plan options. Some employers don't. They only offer one plan. If that's the case, then that plan is what it is. But some employers offer multiple options, and you might find that you can switch to a different plan that your employer offers and get lower out-of-pocket costs when you need care. And if it's possible, again, discuss all this with your doctor and see, is it possible to put this procedure off until my health insurance changes? If it is, that might be an option. But if not, if you're kind of stuck in the plan that you're in, talking with the medical office about setting up a payment plan is probably your best option for now, especially if you need the care sort of urgently.
Thank you, Louise. And our next question is from Jennifer that wants to know what's preventative care suggested for my medical history. She tested positive for some specific genes. And granted, we are not doctors. We are not offering medical advice for your situation. But in general, what kinds of preventative care are covered by Medicare? Diane?
So actually, Medicare now covers a very wide range of preventive care services, everything from mammograms to lung cancer screenings, prostate cancer screenings, colon cancer, lots and lots of different preventive care services without any copays. Talk to your doctor about the preventive care services that you need, and you should be able to get those.
Thanks. And we don't know if Jennifer's on Medicare or private insurance or Affordable Care Act, so we're just giving sort of general answers. And Louise, do you have some thoughts, assuming that she's on an Affordable Care Act plan or maybe an employer plan, or how can she find out, what preventative care options are available?
Sure. So if she's on an employer-sponsored plan that's not grandfathered, or an individual market plan that's not grandfathered, there is a wide range of preventive care services that do have to be covered with no cost sharing, which means no deductible, no copay. But in this case, we mentioned that she tested positive for some genetic markers for cancer. The preventive care services that have to be covered are generally the same across the board. There's a certain category of services for children, for women, and then for all adults. There is BRCA 1 and 2 screening. Genetic screening is covered by most plans, depending on the patient's medical history and family history. Beyond that, specific genetic screening is going to vary from one plan to another. But then if you test positive for something genetically, you're going to want to talk to your doctor about what sort of preventive care do they recommend based on that scenario. And then you're going to need to check with your health plan to see whether that actually falls under the category of preventive care that has to be covered without cost sharing versus preventive care that you might have to pay your copays and deductible for. So that once you get to that level, would just need to contact your plan.
Thank you, Louise. And thank you to everybody who joined us today for Care Talk. We'll be back next week live at 4:30 Eastern Time on Mondays and available as a podcast the next day. So please keep calling and texting in your questions, and we will try to get you answers in future shows. That number is 202 888-6837. Open enrollment is going on now for Medicare and Affordable Care Act, so it is time to get covered. And we'll keep talking about what may be happening for your health insurance and your health care in America next year. So thanks for joining us. This is Care Talk.